Hello there. I'm Regina from Home Therapy Solutions here in Kennesaw, Georgia. We serve Cobb County, Cherokee County, and a little bit of North Fulton. And I'm going to talk about the difference between home health and home care and when you should get outpatient therapy versus when home health will do the job for you. And usually people are calling me, asking me these questions because their loved ones are in the hospital or they're coming home from a rehab center. And the question usually goes something like, okay, my loved one's coming home. I know that they need therapy, but I don't know if it should be home health or can we work with you guys? So home health is a skilled service. It is billed under Medicare Part A. And that's just important because the way that they're billed are different. So home health is paid for by insurance, of course, and it's a skilled service meant to get your loved one stable. And so it's short term. I mean, as soon as they're stable, then they're going to be discharged and you have to go on to the next level of service. Home health is particularly important if your loved one has a skilled nursing need. So that would be, for example, they need wound care. That's a skilled nursing need. They have IV antibiotics and they need a nurse to administer. They have medication problems and they need the nurse to sort them out and make sure that they're all set. Or maybe their vitals have been really unstable and it will take a nurse to monitor those vitals. So if any of those boxes, if you said like yes to any of those, then home health is your best bet. Now, if you're like, nah, my dad, he's coming home, but he can go out for wound care, like he's going to go to a clinic and have the wounds managed, or the vitals are kind of questionable, but you feel like you can monitor the blood pressure yourself, for example, then you might want to go ahead and have outpatient services with home care. Now, home care is different than home health. Home health is skilled and bills Medicare. Home care is not considered skilled and it's private pay, no billing insurance. There are some situations where you can get waivers or Medicaid, but that's a side note. Don't get confused. Home health bills Medicare. Home care is private pay and is just your basic services like bathing, dressing, companionship. They can remind you about your meds, but they can't administer them. Housekeeping, giving you a ride, preparing meals, all those kind of cool things are what home care does, and that's privately paid. Now, where Home Therapy Solutions fits into the equation, we are outpatient therapists. So imagine, you drive to a clinic, get out of the car, go into the clinic, have your therapy, finish up there, and come back home. So we obviously don't do that. We come to you because we believe that a great place to get therapy is right there at home where you're actually going to be living your life and doing your daily routine. So what we do is we do bill Medicare. The services are paid for under Medicare Part B and almost all commercial insurances too. And the difference is that we can do much more than stabilize the patient. So as we can really work one-on-one with that patient until they meet their goals. Medicare says that the certification period can be 12 weeks long. And we just have to justify every 10 visits, we have to justify the progress that the patient is making to show that they're meeting their goals and that our services are still medically necessary. So as long as we do that, we can keep on going to meet high-level goals. Physical therapy is going to address strength, balance, endurance, that kind of thing. Occupational therapy should be called functional therapy. So OT is going to work on all the functions and have that person be able to live their life as independently as they can. Bathing, dressing, cooking, cleaning, medications, housekeeping, making a meal, all that fun stuff. And then we have speech therapy, which is about speaking and understanding, but it's also about swallowing and cognition too. So we work with the patient for as long as it takes, as long as they're making progress, to meet their goals. All right, so let's just recap. You've got home health, which is skilled and short term. And yes, they do bill Medicare and other insurances. And then you've got home care, which is not skilled, private pay, except for the occasional exceptions. And they are they could be as long term as you want, as long as somebody needed them to keep them at home. And then you've got outpatient therapy. In this case, we come to you. The idea is to make your life easier. And yes, insurance does pay for that. So I hope that information was helpful. Oh, I'll give you a little tidbit. If your loved one needs skilled nursing, like we talked about, wound care, med management, IV antibiotics, vitals monitoring, if they need skilled nursing but you'd prefer to have the more intensive therapy at home, then you could work with us. We can bill your insurance for the therapy, and then you can private pay for the nursing on the side. I just met a company today who does that, so we can partner with them and offer that to you. That program I'll do another video about. It's called Rehab at Home. So I hope that this was helpful information. I would be very happy to help you and your family meet all your goals for aging in place, staying at home as long as possible, whether that home is an independent home, whether you live in a community, whether you're in an assisted living, no matter where you call home, we'd be happy to come and help. So feel free to reach out. We're at georgiahometherapy.com. Actually, that's GAHometherapy.com. Or you can call me at 678-632-8189. Have a great day. Talk to you soon.